माझं नाव प्रीती ओके आहे. I come from Nasik. Prior to going to Nasik, I was living in Borivali. This is my father, Mr. Subodh Karve, and my mother, Rekha Karve. मी नाशिकला राहत होते and I heard, and this is my baby Aryan, and नाशिकला राहत होते मी. इथे आमचे acquaintances आहेत, त्यांच्याकडून मला सिद्धी लाईफ बद्दल कळलं and we decided to approach Dr. Kulkarni for treatment. माझ्या लग्नाला 7 वर्ष झाली and I've been undergoing treatment for the last 4 years. 2 years of which was in Nasik, which did not give me any results. So we finally decided to come down to Mumbai. And after undergoing treatment for just a year here, my husband, Mr. Mohesh Oak, he works in a pharmaceutical company. And because of this touring from Nashik to Nagpur, we have to be based in Nasik. So actually it was a little tedious for us to come to Mumbai for treatment, but we managed it. When we came to this clinic, the atmosphere was very warm and friendly here. We met Dr. Kulkarni, who explained the procedure of the treatment to us very properly and what all things we would have to undergo during the course of treatment. And that is why we had a very good idea about what we were going to go through. And this is what helped us. Coming to Borivali was easier for me because my parents lived here, and I knew that the treatment was going to take a long time, so I had to commute back and forth. So generally we used to manage and come down and stay here for 2-3 days and then go back again. So we could do that because of this facility also. But I can tell this to other couples who come from long distance that in spite of not having any relatives here, it would be easier. There are a lot of places where you can board up for 2-3 days and then undergo the treatment also. And when I conversed with other patients who had come here, I found many of them suffering from the same problem. This type of a problem is curable and I underwent treatment for it, the result of which is my baby. And basically it was a long process. I underwent 4 cycles of IUI which failed. It was disappointing and it requires a lot of patience and positive attitude. I would like to tell the patients here that you have to keep your chin up all the time. After undergoing IUI, we decided to go in for FSP, which is a higher procedure as doctor told me. But there too we did not achieve any success. So finally the option left in front of me was IVF, which I was very reluctant to go in for. So I took a break in the treatment for 2 months as I was busy with my work in Nasik, and then decided to give one last shot at it. So we came back to Bombay and doctor told me that we would do an IUI with you one more time to see. And to be honest, I was shocked that it clicked.
When my daughter came to Dr. Kulkarni for the consultancy, he was briefing me all about the procedures and the discussion that were taking place with Dr. Kulkarni. I am also a technical man and I was going through that whole process with typical analytical mind. And what I found was that whatever steps he was following, one thing was he was very clear about what is to be done, and in a very methodological way he was doing that. And this particular polycystic ovaries problem which she had told me, I also searched on the net and then found that it's possible that within relations it could be possible. I mean, it may occur in her relations or sisters or something like that. So it's better that it is investigated by the people concerned. And overall we were very happy and we were sure anyway getting children it's a luck, but then luck factor is maybe 10% and the 90% sure success is there. That's what I know.
I found out that my test results had come positive. The beta HCG value had shown some high values, and doctor had told me that the chances were a little bit higher. So he had asked me to avoid traveling back to Nasik, and I was staying here for a week. The second beta HCG value was totally unexpected. It was totally high, and when doctor congratulated me, I was just looking at his face and wondering whether he was fooling with me. And I gave a call to my husband, and doctor spoke to him on the phone, and he too was stunned. So he was here with me the very next day, and then we came to meet doctor and confirm the news. It was still not sinking in. So I asked doctor whether it was really true, and he told me that you would know it when you hear your baby's heartbeats for the first time. So a couple of days later, when I underwent sonography here and I saw the heart beating, that was the day which I was being waiting for a very, very long time. Once my pregnancy was confirmed, I knew that I would have to take a lot of care because it was a very valuable pregnancy to me. And I asked for the advice from the doctor. He referred me to a dietitian who gave me a very good diet which I could follow so that my BP could remain in control and I could have a very easy pregnancy. I was told to follow a very healthy diet, take regular walks, and generally be relaxed about the pregnancy. So I went back to Nasik and followed everything whatever instructions were given to me, I followed them. I used to do my sonography at Nasik and then send the reports here by courier to the doctor so that I did not commute all the time. That saved a lot of time and plus energy also. I used to come down here say after 3 months so that I could get myself checked here because I was going to deliver my baby at this hospital. Basically I didn't have any problems and my pregnancy was going along very smoothly. I was walking around till the last day. I didn't have any problems, and from what Dr. Kulkarni told me that it would be a normal delivery for me. That is what she told me, and we were trying for that. The day of my delivery was, or the day of arrival of my baby was given to me as 25th Jan. We were waiting till 24th of Jan, but nothing seemed to happen. So I got admitted on 24th of Jan. I was given some injection to start my labor pains, but still nothing happened. On 25th of morning, when nothing seemed to work for me, my blood pressure started rising because of the long hours of waiting, anxiety. And finally, when the BP started rising, my doc told me that it would be better if we could go in for a C-section, to which I readily agreed because whatever labor pain I was enduring were too much. So finally, at around 3:30, I was taken into the labor room. I was sitting on the delivery table, waiting to know what was going to happen. And everything worked out fine, everything went on smoothly, and I delivered a healthy baby at 3:50 p.m. and that was the ultimate joy for me, and it removed all the traces of pain, agony, anxiety, whatever I had endured all these years. So it was worthwhile. Now my advice to other girls who are suffering from polycystic ovaries is that go to an endocrinologist on time, get yourself treated. It is treatable and it could work for you. Please don't ignore it and treat it on time. This treatment is time consuming, it requires a lot of patience, but with a positive attitude, you too could be blessed with a beautiful baby like mine.